What is the source? Well, the two questions. So the first question is, what is the source of the social crisis? How do we understand its causes?
The crisis we have in health is a much deeper crisis than we would want to see. It's a crisis where there's a crisis of values. There's a crisis in individual human beings. And those that were freedom fighters 20 years ago have turned out to be mercenaries.
Poverty is increasing, social inequality is increasing, and we are, I think, facing a really serious issue of social disintegration.
And I think what I want to contextualize this in is the nature of social reproduction in society is about how do you reproduce the classes, the status quo, and how do you reproduce the social relations in the society in which we live. And the status quo for us in South Africa is a capitalist society which is still very much a racial capitalist society.
These are some aspects of the ideological war in terms of education. There's lots of obfuscation, but really what it boils down to is that education plays a role in perpetuating the system of inequality. And this system is called capitalism. People talk about blaming OBE, the new curriculum, the teachers, etc. But the reality is that unless one understands that it's a social class-based education system, you're going to lose track. Despite the reforms, etc., it continues to play a vital role in ensuring the survival of capitalism.
5% of white children are poor. So we have a situation where poverty is still highly racialized. And I think the key to understanding the social crisis is not any of the things I've mentioned, but the fact of inequality, the way inequality is growing.
And I want to focus on, in particular, how black workers are being reproduced. Because since, and I think we've heard quite a bit this morning about neoliberalism, etc. Since the onslaught of neoliberalism in the gear in 1995, there's been mass unemployment, mass retrenchments, etc. and so forth. And what is actually happening is that more and more families, the only source of income is this child support grant. Now, we need to look at this against the backdrop of democracy in South Africa, against the backdrop of constitutional rights, far-reaching constitutional rights, socio-economic rights, etc., as well as women's rights, right? Because women are no longer minors. Women are supposed to take their places in the world. And what we have is that we actually see changes in the family forms as well. As men are being expelled from the workforce, they're also being expelled, in a sense, from the family because they're no longer breadwinners.
And if you go back, those that ran the country before knew that discrimination based on color cannot be taken into the future. And they sat down and planned the future that we have today. Discrimination continuing forward, but not on the basis of color of your skin. It's on the basis of ability to pay. It became a means discrimination. So you have discrimination far more ferocious than the discrimination of before at a personal level.
There are millions of young people out there who are not working, who don't have a job, who are not in school or university, millions of people. And there are tremendous social consequences for that. But they are not being productive, they are not in education for particular reasons, which has to do with social relations under capitalism, with the way the economy is structured and how it relates to the political realm. So unless we factor in those issues, then our analysis is in the realm of the absurd, and we are not taking forward an understanding of what the crisis is about.
At the core of the crisis, we have this developing, widening gap between people's needs and their rights. It's true of neoliberalism as an ideology. Neoliberalism is the ideology that is driving global capitalism. And the key idea in neoliberalism is this individualism, this me, myself, I.
Because at the end of the day, as we know, it is workers who create wealth. So it's not a conspiracy, right? But what is the kind of labor, what is the kind of jobs that black workers look forward to on a daily basis? I think if we look at men on the road who sit at traffic lights, etc., waiting for jobs, if we look at the way in which labor has been casualized, temporary, precarious, etc., you get a job for today, you don't get a job for tomorrow.
I think part of the problem was that we in South Africa had what some people have called a double transition. And in the moment we had democracy, we also entered into the market economy, the global market. And this ideology of individualism, I think, is strengthened, but it's a global phenomenon throughout the world.
And we find that as a nation, we're in crisis in both respects. In terms of the level of care the state gives to its citizens in totality, and the responsibility of citizens. And I think HIV clearly highlights that respect. Now, if you treated everybody, you'd probably be talking about 1.5 million people. If we use best practice from the globe right now, which is treat, and the CD4 is 350 or less, it is estimated that about 3.5 million South Africans would need to be on treatment. Now, clearly, we're not going to be able to treat ourselves out of that epidemic.
I think that we have a number of challenges as progressive people, as the left, but a forum like this allows us to discuss and debate and critique. It also allows us to link up with the health struggle, with the education struggle, with issues of reproductive rights and culture, progressive culture, a counterculture.
I think that when we talk about resistance and what can bring us all together and the kind of vision that Lebogang was talking about this morning that we had during the anti-apartheid struggle, to me it's got a name. And to me, that vision is eco-socialism, not socialism of the Soviet Union and the involved all kinds of problems of authoritarianism and environmental abuse, but an eco-socialism that redefines our relationships to each other and to nature.
If we're going to survive as a people, we've got to change our sexual behavior. Because this is going, if Ita Besaida note says, HIV and AIDS will do what apartheid failed to do in this country. It tried to get rid of us. It failed. But if we don't change our behavior, the virus will.
As long as there is capitalism, social crisis will exist and economic war is prevail.
Our economic system is structured to such a way that it will benefit the rich at the expense of poor.
How do you justify that one of the top officials in the correctional service bought himself, herself, Mercedes and other ministers bought one going to Mercedes-Benz, and yet now the blame is put on us?
I think you're correct when you say, I should also suggest that the middle class, those of us in the middle class, have got a dilemma. And it's not just only in healthcare, it's also in education as well, with ex-military schools and so on. And the dilemma is that we do benefit from a two-tier system, whether in education or healthcare.
In a capitalist society, it's always the case that the rich will always get richer and the poor will always get poor. So for me to blame the poor on the system that they have not created, it's absolutely unfair.
Draw the links, connect the dots. The only way to do that is to link our struggles and really to point at the monster. We must fight for social reforms, and we're all trying to do it.